Welcome to Health Talk. Today's program is about an important procedure available at Pikeville Medical Center that could save your life. Our topic today is electromagnetic navigation bronchoscopy, or E&B for short. Today, lung nodules are being detected at a higher rate than ever before. However, those nodules are often located in areas of the lung that traditional bronchoscopies cannot reach. I'm Laura Dameron, and today our guests are Dr. Obaida Harfouche, pulmonologist and clinical director of Pikeville Medical Center's Pulmonary Clinic, and Ronnie Justice, certified respiratory therapist. Dr. Harfouche, let's start with you. If you would, tell us a little bit about your background, your education, experience, and why you chose Pikeville Medical Center.
I'm Obaida Harfouche. I'm originally from Syria. I finished my medical school at University of Damascus in 2000. Then I decided to come to the United States. Actually, I did some internal medicine residency there before I came here, and then in 2008, I started my internal medicine residency at Marshall University, and I did my fellowship in pulmonary disease, and then I moved to Pikeville in 2013, June 2013. So here where I am.
What appealed to you about Pikeville Medical Center and the things that they're doing there?
Actually, I knew about Pikeville Medical Center before I came here, and I know the area because I have been at Marshall University, which is very close to the area. And I know how amazing the hospital and what they are offering for their patients. So I thought that would be a great chance for me to come here after finishing my training. I know the area. I know the kind of patient they have here and how much help they need. So I thought that would be a great experience for me to start here. Also, the city of Pikeville, actually, it's one of the small cities, but actually it is a very active city. You know, you can see, you cannot imagine that you are facing a small city when you are heading toward Pikeville. It's very very crowded area, and I think it's very good for family also, with the schools and that the whole environment is very safe.
Well, we're very lucky to have you at our hospital and in our community.
Thank you.
Ronnie, if you could tell us a little bit about what you do at the hospital.
I'm a certified respiratory therapist. I work for the pulmonary physician's practice. Basically, I do the pulmonary functions test, patient educations on different medications that's out being prescribed, and also qualify patients for home oxygen, doing 6-minute walks, and any kind of respiratory event in the office I take and do.
Great. Well, now that we've talked a little bit about your backgrounds, let's get into what is this E&B procedure. Dr. Harfouche, if you could tell us, what is E&B and how does it differ from a traditional bronchoscopy?
E&B is a new technology. It's using electromagnetic technology in identifying the small lung nodules or lung lesions that were not accessible by the conventional or the regular bronchoscope. So it is very good in diagnosis and even to help in the treatment of lung lesions. So basically, peripheral lung nodules or lesions, we cannot access them through the regular bronchoscope. The airway has, you have a certain area where you cannot go beyond in the lung tissue. After this area, the electromagnetic navigation bronchoscopy will guide us through a steerable sensor, probe, and extended working channel that's 360-degree steerable, that will lead us to that lesion, and then we can use all sampling tools to get tissue and samples from those areas. So it is very good tool, started in 2004 actually, and I think it has a good horizon to work more on in the future, I think.
Are there any side effects associated with E&B, Dr. Harfouche?
It is minimally invasive. There are some side effects, but I think it is even less than the regular bronchoscope, because with the EMB we can now go and target the lesion itself, and the chance of getting, damage beyond the lesion is less. In general, it's less than 3%. We get some complications, but so far since I started here, we have only one late complication of 100 of procedures we have done. So it is very minimally invasive and has low complication rate. Sorry.
Tell us a little bit about recovery. Do patients go home immediately? What is the recovery time?
It's a same-day procedure. So the patient will come an hour before the procedure. It takes about between 20 minutes to 45 minutes. It depends on the lesion's location, the size of the lesion, and then the recovery will take about 1 hour. The patient has to stay under monitoring in the recovery room, and then they can go home the same day.
Wonderful. Well, that's amazing. What happens if a patient is diagnosed with lung cancer? What happens next for that patient? We work as a team with other specialty, with thoracic surgery and with oncology team. So whenever we get the diagnosis or we get the results back, then we talk to oncology team and to thoracic surgery team and decide about the best plan. Also, we have every other week tumor board round for those cases, and we get together and discuss about those cases and what would be the best for a treatment of the patient. Well, it sounds like Pikeville Medical Center takes a very comprehensive approach to treating lung cancer patients as well as all cancer patients, but that's phenomenal. And I know that you said earlier, you talked about the patient type in this area, the prevalence of lung cancer and lung disease. Can you elaborate on that a little bit for us?
Yeah, actually this area, I'm sorry to say that, but the smoking is very, very common. And we see a lot of people, especially people who worked in the past in coal mines, and they got a lot of lung nodules. And lung cancer, sometimes lung cancer starts as a nodule or a small lesion, and with this, a lot of COPD patient or emphysema patients, a lot of asthma. The area, too many people, they have allergy types, and all those will cause some respiratory symptoms and shortness of breath. So it is kind of a wide variety of patients we see in this area, and we treat them and take care of them.
Is there anything that you would like to say to people in our area about smoking and the importance of quitting smoking?
Quitting smoking, I talk to my patients. I do that every day with each patient. I think it's very, very important to quit smoking, and it is never late. Even people who gets diagnosed with lung cancer, I think now with what we are doing, what we have in technology, there is a good chance the patient will get good treatment, and they have a chance to live longer now. And smoking cessation is very important to help him to go through that. And also it's helpful at the time of diagnosis of lung cancer. The smoker has always a higher risk for surgery. So it's very important. On the other hand, the COPD, emphysema, all these kind of lung disease, they are mainly caused by smoking. So it's very important.
Important advice that we should all listen to.
Definitely.
Ronnie, are there any programs that Pikeville Medical Center offers in the pulmonary clinic to help patients with lung cancer?
It's actually in the pulmonary practice. We can refer patients to pulmonary rehab. Of course, we have our oncology team and thoracic team. If the doctor deems necessary, we make referrals to. Once the patient has gone through treatment, we can bring them back to pulmonary rehab and help them build their strength back up into the lungs and get them back to a quality of life that they was used to living before. And
What would a patient experience in pulmonary rehab? What does that entail?
Basically, bring the patient in, go over a brief questionnaire, get a history on them, and basically we set up a exercise program that benefits them, something that they can work with, and it doesn't overburden them with too much exercise at one time. So we take basically baby steps and work them up to where they was at before they came down with any kind of illness.
Well, we talked a little bit about what we're doing to detect and prevent lung cancer and other lung diseases. Are there anything else that people in this region need to know?
I think this is also very important. We have recently started a lung cancer screening program at Pikeville Medical Center, and that will help us to detect the lung cancer in early stages. And with the use of EMB, I think there will be a great chance that we can get those people with early stage lung cancer who has survival rate is always much better than late stages, between 80% in early stage to 5% in late stage. So I think that's a very good opportunity for our patients here, especially the smokers. And there are criteria. If they meet those criteria, and we can send them for a low-dose CT scan, which is it's almost equal to a regular chest X-ray, and that's the good point of it. So the patient will not get the same amount of X-ray with the regular CT chest. And I read those results, and then Ronnie will send the messages or letters for all those patients with their results, and also we communicate with their primary cares. This way we can kind of take care of those patients and diagnose lung cancer and any other lung disease as early as possible.
Also, we've also started smoking cessation classes now. They go for a 12-week course once a week. They help the patients deal with the stress of quitting smoking, and also help them with different, like the nicotine patches, the gums and everything, to help the cravings of the nicotine so they can actually become smoke-free. And hopefully within that 12-week time they be smoke-free and graduate from the class that way.
Well, that's wonderful, and that's wonderful that Pikeville Medical Center is doing things to help patients quit smoking, to give them that additional resource to stop, because I'm sure that it is difficult for some people to just stop on their own,
it's
and
tough.
they have that support, so that's great. And again, Pikeville Medical Center is taking a very comprehensive approach, and it sounds like the communication between your team and patient specialists and primary care physicians is wonderful, and we're fortunate to have you helping Pikeville Medical Center, stay on the cutting edge of these new procedures. And Pikeville Medical Center is the only hospital in this region to offer E&B. So, as you know, and we're fortunate to have you doing that. So how would a patient become a patient at the pulmonary clinic? Do you take walk-ins, or do they need a referral from their primary care physician?
For walk-ins, it depends on the in very special situations. But usually, any patient can call our number, the pulmonary office number, and we can schedule them for an office visit as soon as possible.
Okay.
I think we can take less than a week all the time. Within the same week, we can take office visit. And referral from other physicians or primary cares also, that's also possible. So,
to make an appointment at Pikeville Medical Center's Pulmonary Clinic, please call 606-218-4689. You may also call that number to learn more about Pikeville Medical Center's smoking cessation classes. Dr. Harfouche, Ronnie, thank you so much for joining us today. Thank you for your time.
Thank you for having us.
Thank you for inviting us.
I'm Laura Dameron for Pikeville Medical Center, a proud member of the Mayo Clinic Care Network.